Welcome to AudioMeds, audio medicine from your physician to help you increase your knowledge concerning your health. If you have additional questions following this audio program, please be sure to contact your physician. Hi, I'm Charlie Roney. You are probably listening to this because you or someone you love has been diagnosed with benign prostatic hyperplasia, BPH, commonly referred to as enlarged prostate. You asked your doctor all the questions that came to mind during your office visit, but now, as you think through that information, you'll probably want to know more. This audio program has been developed to expand on what your doctor has already told you. It will provide you with a good understanding of what benign prostatic hyperplasia or BPH is, the benefits and risks of the different treatment options, lifestyle changes that can help improve your quality of life, and where you can find more information if you need it. The first thing you should know is that it's very common for a man's prostate gland to become enlarged as he gets older. It's a normal part of the aging process, just like gray hair. So there's no reason to feel uncomfortable talking about it or asking your questions. By age 50, more than half of all men in the U.S. have an increase in the number of normal cells in the prostate observed under the microscope. This overgrowth of the prostate is called BPH. Up to 90% of men older than 80 have BPH, but only about a third of the men who have it will be affected by symptoms, and only 10% will need medical or surgical help. What exactly is benign prostatic hyperplasia? Benign means non-cancerous. Hyperplasia means too much growth. It's the medical term for a non-cancerous enlarged prostate. BPH is a common urological condition. It evolves very slowly, and if you do have symptoms, there are treatment options to manage them so they don't affect your daily activities. The prostate is a small gland that is part of the male reproductive system. It's between the bladder and the base of the penis. The main function of the prostate is to produce the fluid that carries the sperm during ejaculation. A healthy prostate is about the size of a walnut. As a man ages, the prostate goes through 2 periods of growth. First, at puberty, when it doubles in size. And then, at around age 25, it starts to grow again. Later, at the age of 80, almost 90% of men could have BPH. Scientists don't know exactly what causes BPH, but one of the main risk factors is aging. They also believe that hormone levels could have something to do with it. A family history of enlarged prostate could increase your odds of having BPH. It's found more often in American and European men than in Asian men. And they don't know why, but married men are more likely to have it than single men. What are the problems that BPH causes? The urethra is a tube that goes through the center of the prostate. In a man, the semen and urine flow through the urethra and out the penis. If the prostate is very enlarged or the smooth muscles within the prostate contract, it could squeeze the urethra or put pressure on it, irritating or blocking the bladder. The bladder wall thickens. It starts to contract even when it only has a little urine in it, causing a man to urinate more often, and eventually the bladder gets weaker and can't empty itself fully. So the narrowing of the urethra and the partial emptying of the bladder cause a lot of the problems that come with BPH. How is BPH diagnosed? Often men have no symptoms from BPH at all. The amount of the enlargement is not necessarily related to having or not having symptoms, but you probably had some, and that's what prompted you to see your doctor for a diagnosis. They vary, but the most common symptoms are a weak or slow urinary stream, a urinary stream that starts and stops, a feeling that you can't empty your bladder, the need to strain to empty your bladder, problems with starting to urinate, urgency, leaking or dribbling, more frequent urination, waking up more often at night to urinate. To make the diagnosis, your doctor probably asked you some important questions about your medical history. your family medical history, and your symptoms, especially any problems with urination. You may be given a questionnaire, the American Urological Association's BPH Symptom Score Index. There are a number of diagnostic tests that can be done to confirm BPH. What the doctor chooses will vary for each patient. These are the most common ones. Because the prostate is an internal organ, the doctor can't see it, but it can be felt. For the DRE, or digital rectal exam, the doctor puts a gloved, lubricated finger inside the rectum. This is how the doctor is able to check the size and condition of your prostate. The PSA blood test measures the level of prostate-specific antigen. Higher levels can indicate BPH, inflammation of the prostate, or prostate cancer. Both the DRE and the PSA are often done as part of a routine physical exam for any man over 50. For African Americans and men with a family history of prostate cancer, these tests are done starting at age 40. There are a few other tests your doctor might order. A urinalysis, to check your urine sample for traces of blood or infection. A cystoscopy. For this, the doctor inserts a small tube through the urethra opening at the tip of the penis to see the inside of the urethra and bladder and check the size of the prostate and locate any blockage. There is also the urinary flow test to measure the strength and amount of your urine flow. The post-void residual volume test, or PVR, to find out if you can empty your bladder. Urodynamic studies are done to measure bladder pressure and function. Also, to rule out prostate cancer, your doctor might recommend a rectal ultrasound. A probe is inserted into the rectum, and sound waves form an image of the gland on a screen. In suspicious cases, your doctor may also perform a prostate biopsy. Or an intravenous pyelogram, which is an X-ray image using a dye of the urinary tract and can pinpoint anything abnormal, like urinary stones, a tumor, or blockage above the bladder. Maintaining a healthy lifestyle and eating habits might help you reduce your symptoms. Men who follow a low-fat, low-cholesterol diet with plenty of fruits and vegetables have a lower risk of BPH. Check with your doctor about changing any unrelated prescription medications or over-the-counter decongestants that might be making your symptoms worse. You might also consider avoiding caffeine, alcohol, and spicy foods. They can make you urinate more often. Some other daily tips. Keep your bladder as empty as possible. Try to urinate as much as you can each time. Stay active. Just a little bit of exercise can help with your symptoms. Stay warm. You might retain urine in cold weather. And don't drink too much in the evening or right before bed. So, just keep in mind that what you have, benign prostatic hyperplasia or BPH, is the most common prostate problem for men over 50. And as many as 90% of men in their 70s and 80s have it. You are not alone. It's not cancer, and it doesn't lead to cancer. But it's important that you talk to your doctor and decide together on the best treatment approach for your symptoms and your overall health. Thanks for listening to AudioMeds.